Hello, my friends. Thank you for joining me today for this important conversation about health and well-being in our golden years. I'm so grateful that you've taken time out of your day to be here with me. Today, I want to talk about something that might feel a little uncomfortable at first, but it's a conversation we need to have. We're going to discuss 5 subtle signs that might indicate an elderly person, perhaps yourself, a spouse, or a loved one, may be experiencing significant health decline. Now, I want to emphasize right from the start, identifying these signs isn't about giving up hope or accepting defeat. Quite the opposite. By recognizing these changes early, we can often take meaningful steps to address them, potentially extending both the quality and length of life. Many of these I've spent decades working with seniors, and I've witnessed remarkable turnarounds when warning signs were caught early and addressed properly. So let's approach this topic not with fear, but with wisdom and empowerment. Knowledge truly is power, especially when it comes to our health. Let's dive into these 5 subtle but significant signs that warrant our attention. Unexplained weight loss and changes in appetite. One of the most overlooked yet significant indicators of potential health decline is unexplained weight loss. When an elderly person begins losing weight without trying, perhaps dropping 10 pounds over a few months without any changes to diet or exercise, this deserves immediate attention. Let me share a tale of 2 friends to illustrate this point. My friend Margaret had always maintained a steady weight throughout her 70s. She was known for her hearty appetite and never missed her Sunday dinners with family. But when her daughter noticed that Margaret had lost nearly 15 pounds in 3 months and was often leaving food on her plate, they became concerned. Upon medical examination, Margaret was diagnosed with early-stage pancreatic issues that, caught early, could be effectively managed. Compare this to my neighbor Frank, who dismissed his own weight loss as just getting older. By the time his family convinced him to see a doctor, his undiagnosed condition had advanced considerably, making treatment much more challenging. What's happening in these cases? Unexplained weight loss can signal several serious conditions. Digestive issues affecting nutrient absorption, certain forms of cancer, advanced heart failure, hormonal imbalances, due to depression or anxiety affecting appetite. What you can do. If you notice yourself or a loved one losing weight without trying, don't simply attribute it to old age. Track weight weekly, note any changes in appetite, and report any loss of more than 5–10 pounds to a healthcare provider promptly. Sometimes simple declining energy and increased fatigue. We all experience diminished energy as we age. That's normal. But there's a significant difference between needing an afternoon nap and feeling exhausted after minimal activity. This profound fatigue that doesn't improve with rest can be a warning sign of serious health decline. Consider the stories of 2 sisters in their early 80s. Elizabeth began noticing that her daily walk to the mailbox, once an easy task, suddenly left her winded and needing to sit down for 30 minutes to recover. Instead of dismissing this as just getting old, she mentioned it to her doctor, who discovered her hemoglobin levels were dangerously low due to a slow internal bleed. With proper treatment, her energy returned within weeks. Her sister Vivian, however, attributed her own increasing fatigue to just needing more rest, and began spending more hours in bed each day. She withdrew from her book club and gardening society because she was too tired. By the time her family intervened, Vivian's untreated heart condition had progressed significantly. This type of fatigue may indicate anemia or nutritional deficiencies, heart failure, kidney dysfunction, medication side effects or interactions, sleep apnea or other sleep disorders, thyroid dysfunction. What you can do: keep a simple energy journal for a few weeks, noting activities and fatigue levels. This information can be invaluable to your doctor. Don't accept profound fatigue as inevitable. Simple interventions like iron supplements for anemia, medication adjustments, or treatment for sleep apnea can dramatically improve quality of life. But only if you bring these symptoms to medical attention. For daily energy maintenance, ensure you're properly hydrated, eating protein with each meal, and getting appropriate light exposure in the morning to regulate your circadian rhythm. These simple habits can help stabilize your energy levels. Changes in cognitive function beyond normal aging. We all experience some cognitive changes as we age. Forgetting where we placed our glasses or taking longer to recall a name is normal. But certain cognitive changes signal something more serious that warrants prompt attention. Let me contrast the experiences of two longtime friends. Robert occasionally forgot appointments and sometimes repeated stories to the same person. But with calendars and reminders, he managed well and continued his volunteer work. His cognitive challenges remained relatively stable. Meanwhile, his friend Thomas began showing more troubling signs. He got lost while driving familiar routes, had difficulty managing his monthly bills, despite having handled complex finances all his life, and showed uncharacteristic confusion when following simple recipes he'd made for years. His family noticed these changes, accelerating over months rather than years. Significant cognitive changes may indicate early stages of dementia or Alzheimer's, silent strokes or mini-strokes, medication side effects, vitamin B12 deficiency, thyroid issues, urinary tract infections, which often present as confusion in elderly people. What you can do: document specific examples of concerning cognitive changes to share with healthcare providers. Many causes of cognitive decline are treatable if caught early. Request a comprehensive cognitive assessment and necessary tests to rule out reversible causes. To support brain health daily, engage in regular mental stimulation through puzzles, learning new skills, or social interactions. Physical exercise has profound benefits for cognitive function, as does maintaining social connections. Even 15 minutes of daily walking can improve blood flow to the brain, potentially slowing cognitive decline. Subtle changes in heart health indicators. Heart health changes often whisper before they shout, and recognizing these subtle indicators can be life-saving. While chest pain is an obvious warning sign, many heart issues manifest in ways we might not immediately associate with cardiac function. Consider my friends Helen and Dorothy, both active women in their mid-70s. Helen noticed she could no longer carry her groceries up one flight of stairs without stopping to catch her breath, despite having managed this easily just months before. Instead of assuming this was just age decline, she mentioned it to her doctor, who detected early signs of heart failure that could be effectively managed with medication and lifestyle modification. Dorothy, however, attributed her swollen ankles and occasional shortness of breath to the summer heat and her age. She didn't realize these were classic signs of developing heart issues until she experienced a much more serious cardiac event that could have been prevented with earlier intervention. Important heart health indicators to watch for include decreased exercise tolerance. Activities that were once easy become challenging. Shortness of breath when lying flat. Swelling in the ankles, feet, or abdomen. Unexplained fatigue, especially during activity. Irregular heartbeat or palpitations. Persistent cough or wheezing, especially when lying down. Confusion or impaired thinking due to reduced oxygen to the brain. What you can do: monitor your blood pressure regularly at home, as many heart issues begin with hypertension that causes no symptoms. Keep a log of any unusual symptoms like those mentioned above, noting when they occur and what makes them better or worse. For daily heart health maintenance, prioritize a Mediterranean GLA diet rich in vegetables, fruits, whole grains, lean proteins, and healthy fats. Limit sodium intake to help prevent fluid retention. Even modest physical activity, like a 10-minute walk 3 times daily, can significantly benefit heart health. And remember, it's never too late to quit smoking. The heart begins to heal almost immediately. Social withdrawal and loss of interest. The emotional and social aspects of health are just as important as the physical. One of the most overlooked yet significant indicators of decline is a marked withdrawal from social activities and diminished interest in once beloved hobbies and relationships. Let me share the contrasting stories of James and William, lifelong friends in their early 80s. James, who had always been the life of community gatherings, gradually began declining invitations. His woodworking tools, once treasured, gathered dust in his garage. His daughter initially attributed this to normal aging, but wisely recognized it might signal something more serious when combined with other subtle changes. William also experienced grief after losing his wife, but made consistent efforts to maintain his social connections despite the challenge. He continued attending his weekly chess club, though sometimes needing transportation assistance. The difference in their trajectories was remarkable. William maintained better overall function and resilience. Social withdrawal may indicate depression or anxiety disorders, early dementia, hearing loss causing social discomfort, mobility issues making socialization difficult, the medication side effects affecting mood or energy, undiagnosed pain or discomfort. What you can do. First, rule out practical barriers to socialization like transportation difficulties or hearing problems, which have straightforward solutions. If a loved one is withdrawing, create low-pressure social opportunities in comfortable settings. For yourself, set a goal of one meaningful social interaction daily, even if just a substantive phone call. Depression in older adults often responds well to treatment, but is frequently missed because it may present differently than in younger people, with more physical complaints and irritability rather than explicit sadness. Don't hesitate to discuss mood changes with your healthcare provider. To maintain social well-being, consider scheduling regular video calls with distant family, joining community groups aligned with your interests, or volunteering, which provides both social connection and purpose. Even brief social interactions like chatting with a neighbor or store clerk have measurable health benefits. What these signs mean together. While any one of these signs warrants attention, when two or more appear together, it becomes especially important to seek medical evaluation promptly. Often, addressing one area can create positive ripple effects across others. For instance, treating anemia not only improves energy, but can enhance cognitive function and social engagement as well. Remember the story of my friend Eleanor, who showed several of these warning signs: unexplained weight loss, increased fatigue, and withdrawal from her beloved garden club. When her family helped her get comprehensive medical care, they discovered several treatable conditions, including compare this to situations where warnings go unheeded, and precious months of quality life are lost to conditions that might have been manageable with earlier intervention. If you recognize these signs in yourself or someone you love, here are the concrete steps to take. 1. Document specific changes. Keep a simple journal noting when symptoms occur, their severity, and any patterns you observe. 2. Schedule a comprehensive medical evaluation. Request a thorough assessment, not just a brief checkup. Consider bringing an advocate to help communicate concerns clearly. 3. Review all medications. Ask for a medication review to identify potential interactions or side effects that might be contributing to symptoms. 4. Assess home safety. Many of these signs increase fall risk. Simple home modifications can prevent injuries that often accelerate decline. 5. Consider a care coordination plan. Especially if multiple health issues are identified, having coordinated care can make a tremendous difference in outcomes. 6. Prioritize quality of life. Even when facing serious health challenges, focusing on what brings joy and meaning can significantly impact well-being. 7. Have important conversations. Use this time to discuss wishes regarding care preferences, ensuring that values and priorities guide future decisions. Hope and empowerment. I want to close by emphasizing that recognizing these warning signs is not about surrendering to decline, but about taking control of your health journey. Many of the conditions underlying these signs are modifiable, treatable, or at least manageable, in ways that preserve quality of life. The choices you make today, to seek proper evaluation, to address emerging health issues promptly, to maintain physical activity within your capabilities, to nurture social connections, and to find purpose each day. These choices profoundly impact your future. I've witnessed countless older adults reclaim months and years of quality life through timely intervention when warning signs were heeded. Even when facing terminal conditions, addressing symptoms early can make the difference between difficult, chaotic final months and a peaceful, dignified completion of life's journey. You deserve to have your concerns taken seriously. You deserve appropriate medical evaluation without dismissive ageism. And you deserve the support needed to maintain the highest possible quality of life, regardless of health challenges. If this information has been helpful to you, please take a moment to like this video and subscribe to our channel for more content focused on thriving in our senior years. Share this video with friends and loved ones who might benefit from this knowledge. In the comments below, I'd love to hear your experiences, perhaps how you recognized and addressed these warning signs in your own life or for someone you love. Your story might provide the encouragement someone else needs to take that important first step. Remember, my friends, aging isn't just about adding years to life, it's about adding life to years. And recognizing these subtle signs early can help ensure that every day counts. Thank you for your time today. Until next week, take good care of yourselves and each other.